So 2 more videos to go. Next we call upon video number 10. We invite the Chief and Presenting Author, Dr. Sujith Nayanar, on stage. Please.
Hey Pooja, what are you working on?
So see how AI is clearing up this vascular cornea into a clear cornea. I wish there was some real life procedure to make this happen. Today I met a patient in OPD, blind in one eye for 28 years with total limbal stem cell deficiency. Hope we could do something like this to help her.
Actually, that's not AI magic, Pooja. In reality, SLET can give you results just like this.
Sir, are you sure?
Oh yes. Thanks to Dr. Virendra Sangwan and his team. Come, let's plan SLET for this patient too.
Simple limbal epithelial transplantation. The specific phenotype of corneal epithelial cell is protected from the conjunctival epithelial cells by the limbus, which is situated at the junction of the cornea and conjunctiva. Limbus harbors the vital limbal stem cells. These cells reside within the palisades of VT, the specialized niches in a protected environment that constantly replenish the corneal surface and maintain its clarity. This forms a critical barrier preventing the conjunctival cells crossing over to the cornea. Damage to this delicate reservoir can occur from burns, multiple surgeries, chronic infections, inflammation, congenital or idiopathic diseases of ocular surface. Such damage leads to limbal stem cell deficiency, either partial or total deficiency, leading to a condition where the conjunctiva grows over the cornea, making it vascularized and opaque, ultimately affecting the vision. Restoring this stem cell population is the key to reversing blindness. Simple limbal epithelial transplantation or SLET, first described by Dr. Virendra Sangwan, offers a safe and innovative solution. The donor epithelial cells can be from healthy fellow eye in auto SLET or from donor cadaveric eye in allo SLET procedure. Here we demonstrate steps and outcome of an auto SLET procedure performed in case of a 54-year-old female with 28 years of an untreated unilateral limbal stem cell deficiency. Preoperative ophthalmic workup should include an ultrasound B scan to rule out any hidden posterior segment pathology. Anterior segment or OCT imaging is vital in identifying the interface of conjunctival overgrowth and the thickness of residual corneal bed to avoid intraoperative surprises and chances of corneal perforation. The surgical journey begins with the meticulous removal of the deceased pannus, revealing a clear corneal surface ready for transformation. It needs a 360-degree peritomy in case of total LSCD. Excessive surface bleeding is expected in heavily vascularized cornea, which needs cautious cauterization. In some cases, the interface can be easily identified and the pannus can be peeled off smoothly. But in chronic cases like this, meticulous piecemeal dissection may be needed to achieve the targeted result. It is better to avoid sharp instruments for dissection so that unintentional superficial keratectomy can be avoided. Corneal tissue should be preserved at any cost to avoid thinning and perforation at a later stage. View of anterior chamber details and the pupil is a good guide during dissection. All fibrous tissue should be removed from the corneal surface. Bud polishing was performed for smoothing of the exposed surface of cornea, following which the magical amniotic membrane was applied onto the surface with fibrin glue. The membrane should be well ironed onto the surface and care should be taken to avoid redundant edges of membrane to prevent premature dislocation of the membrane by edge rolling. The donor tissue is dissected from superior 2 clock hours of healthy limbus of fellow eye in auto SLET, taking due care not to disturb the donor limbal stem cells. The donor strip of limbus is then split into multiple small pieces, around 8 to 10, and placed equally spaced over the deceased cornea in the mid-periphery. Drops of fibrin glue is then applied over the tiny bits to keep them in place, followed by application of bandaged contact lens. Post-op medications include topical antibiotics, steroids and lubricants till new epithelium takes over. Transformation changes of corneal surface is seen over next few weeks to months, ultimately leading to clearing of cornea due to the restored limbal barrier at the periphery, which also prevents further ingrowth of conjunctiva.
Today has been a true learning experience. Every technique we master is another chance to give sight back to someone who had lost hope.
And it fills me with pride that we Indians pioneered SLET. It shows the world that innovation and compassion can truly go hand in hand.
We carry the responsibility of our patients' trust. They look at us with faith, even to take risks if it means giving vision back.
And while we push the limits of surgery, we must also walk hand in hand with technology. And yes, AI is not our replacement. It should be our companion, guiding us to better care in the future.
That's a very creative video from our upcoming scientific chairman, KSOS. So, Namrata Madam, Charles Sir, please comment.
The AI aspect was very good. AI, Sujith and Deepa look very nice.
No, I think the case was excellent and a case which would have been actually referred for corneal transplantation and failed because of the limbal stem cell deficiency, cleared well, the whole corneal transplantation was deferred and surgery was of course very meticulous, Sujith. You are a very meticulous surgeon. Kudos to you.
Thank you, ma'am.
This patient had blindness or corneal problem for the last 25 years, isn't it?
Yes, sir.
So what was the visual result? Should I have gone in for amblyopia?
No, no, sir. Actually, she was at that age. At that time, her age was in early 20s. The history goes like she was pregnant at that time, most probably some viral illness or something. But after the delivery, by that time, she lost her vision. And she has been going to many places for treatment. After a time, she stopped going. Now her son is a doctor in UK. So it was during his delivery that this has happened.
So you're famous internationally now.
Well done.
Next video, we don't have much time.
Sujith, I really have to compliment you for the wonderful way the video has been presented.
Yes.
The presentation was simply incredible.
Thank you, sir.
Fantastic, the voice and the music and other things. I think we have to learn from this. Thank you.
It's a nice video. One non-scientific query. You were saying sharp instruments should be avoided. While your video was saying you were using Christian knife. So was it to confuse us or
No,
what?
no. Actually, it was a crescent knife only, but it was not a fresh crescent knife. It was
No,
used.
yeah, you can use, and all the knives are not as sharp. So if you
Yeah.
use, I mean, without any financial interest, if you use knives from the Indian companies, they're not as sharp as they are from.
Yes, yes.
And I think you did well, Sujith. Don't listen to it.
No, crescent
No,
knife is not sharp normally.
No,
Crescent
actually,
knife
I specifically added that word because you should not go with the video, saying that it should be sharp. So you should be using a blunt.
Yes, that was the point I
Yes.
wanted to hear from you. Thank